The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
Good morning and welcome to Project Independence and You, Community Talk Radio on 88.1 FM and WCWP.org. I'm your host, Rebecca Miller, along with our co-host, Otto Lohse. How are you today, Otto?
Rebecca, very good. Nice day. Nice
day
in the neighborhood, as they say, you know?
Yes, it is a nice day in the neighborhood. Well, it's great to have you. As always, Otto, you're just such a wealth of assistance and everything. I can't say enough about you and your volunteerism with Project Independence every day, and it's just great to have you here. Also, Kristina Lou is, of course, the radio show producer and also the Director of Senior Citizen Affairs for the town of North Hempstead's Project Independence. She pulls these great shows together every single week with these really special guests. And today our guest is Jessica Giguere. And Jessica is the Regional Account Director for MedMinder. So thank you so much for joining us today, Jessica. We really appreciate you taking your time out to tell us about this really important, I don't want to know if I call it a product or a system, but thank you so much for coming today. And we're looking forward to hearing all about the MedMinder, and just the name of it kind of gives you an idea of the concept of this product. So first of all, welcome. I know that you're joining us today, from your car, but it looks great. We got a great view of you, and so we really appreciate you being here today.
Thank you so much for having me. So we actually call MedMinder Pharmacy a solution, and it's a comprehensive pharmacy, very high touch, but we offer many different services for individual care.
Great. So I know that, I want to hear all about the different things that the pharmacy does, but specifically this, the MedMinder. I mean, it's like, medication is so critical for our livelihoods, especially as we get older, and staying organized and on time. I mean, some medications you take 2 to 3 times a day, sometimes once a day, sometimes once a week, once a month. You're on multiple medications from multiple doctors. And I mean, it's overwhelming, for anyone, let alone, for an older adult, also, who frequents doctors and prescription changes and everything. So how can you just go soup to nuts how this, how the MedMinder works, and, how does one find out about it? So would love to just know.
Sure. Thank you so much. I am really excited to talk to you all today about MedMinder. I truly find that I found my home. I've been in healthcare for 25 years, and throughout the whole process, different, elements of healthcare. And we have definitely seen that medication noncompliance is, a huge, costly, and high risk to the health of our patients and community members. So MedMinder is a fully comprehensive pharmacy. We're able to deliver medication to members in pill form, bubble pack, and then we have our amazing, life-changing smart pill dispenser. Our pharmacy is made up of 4 key elements. We have our pharmacy. In our pharmacy, we have a robotic type of fulfillment machine that will sort and organize medications for our members up to 4 times a day. So a tray of medication can accommodates a morning medication dose, an afternoon, a dinner time, and then a bedtime dose. Our typical configuration is twice a day. So an AM and PM row would be on the first and second row, and then our third and fourth row would be the second week AM and PM. So then we deliver medications to members right to their door 3 days before their cycle is due. So again, individualizing different patients' needs, we would, if the patient couldn't handle the medications themselves, we could deliver it to a family member, caregiver, or a nursing agency. So typically, we do look to partner with managed care partners, nursing aides, VNAs. We work with many managed care assistants in the community, DDS, care coordinators, anyone that is a resource for an individual that needs medication management for, reducing hospitalizations, reducing behaviors, reducing any type of comorbidity that prevents this patient from having a healthy outcome. So again, we have the prepackaging of medications, we have our medication delivery service, and these are all people that work in the health field for deliveries. And then we have our smart pill dispenser. Now, what's unique about our smart pill dispenser is we can remind members to take their medications up to 4 times a day. So, for example, if a member requires a 8 a.m. dose, what will happen at 8 o'clock is the compartment will start to flash, okay? And this is really good for patients that are hearing impaired because they can see the flashing, and then we have a screen that will also say, Jessica, it's time to take your medications, okay? This is at 8 o'clock. Let's say the patient misses the flashing dose, they're in bed, they don't want to wake up. At 8:30, we will then send a customizable greeting to the member through the device saying, Jessica, it's time to take your medications, or it can be customized to, Mom, Dad, it's time to take your medications. Now, it can also say, Mom, take your medications and check your blood sugar, or take your medications and take 2 puffs of your inhaler. Now, we work with many individuals that have cognitive issues, and a voice command could be alarming to them. So it can also just beep at this 8:30 alert time. Now, let's say patient did not adhere to that second 8:30 alert, at 9 o'clock, so 30 minutes later, our pharmacy sends an automated phone call to the member saying, Jessica, still time to take your medications. I'm still in bed. I'm not taking my med. Leave me alone. At 9:30, we can send a text message, voicemail, phone call, or an email to a caregiver, nurse, anyone associated or involved in the member's care, letting them know patient did not take their medications. So then that member care partner can call the patient and from afar assist in saying, hey, how's your day going? Oh, I'm not feeling so great. Well, did you take your meds today? Not yet. I was kind of in bed. Well, maybe you'll feel better if you take your meds. So, it still gives the member a level of independence, but we can still have some assistance from our care, community by calling them. Now, once the member decides they're going to take their meds, all they have to do is open this very easy compartment that is built for people with dexterity issues. Everything around the device has been, collaborated with seniors, nurses. We really try to, design it so it's very easy to use. And so they just open the little lid, take the cup out, take their medications, all alerts will stop, okay? One nice feature the device also has is it is able to be remotely locked or unlocked. And what that means is the only medication compartment that will open is the one that is due at the time and day of the dose, and all other compartments will remain locked. So let's say the patient or the caregiver misses their dose. It can be remotely unlocked from our 24/7 pharmacy or 7-day-a-week support, or a family member or care partner can have access to this patient's account. It's all HIPAA secured on our cloud, and go in and remotely unlock this one particular med dose that was missed.
I have a question. If I just wanted, because you're talking about all the instruction that it gives. What if a medication has to be taken on an empty stomach or with food or something like that, like when there are additional instructions to just taking the medication?
So that's a great question. And that's why during the onboarding process, we get prescriptions from our from the patient's doctor with those instructions. And that's why it's the time frames are significant. So if we hear that the patient takes meds at 8 because that's when they get up to have something to eat, it's set for 8 o'clock. So let's say they want to eat right at 8, they can still take their medication within that hour or two, right? So I mean, we don't have something that says take your medication with your food, but we can. It's very customizable, but that's why it's so crucial to have those planned times that we really encourage our referral sources to inform us on those specifics. But once we onboard a patient, we get all the demographics and a med list. So all the med lists have that instruction, and that's why it's crucial to have those specific time frames.
Jessica, could I just go back to one basic? I happen to have
Thank
a
you.
picture of what it
Yes.
looks like. And I think that's important because we're partially radio and TV, but otherwise people, it's really looks like a laptop, but it's a pill dispenser with a screen basically, which I think gives people a bit of a picture of what you're talking about.
Thank you.
So
yeah, thank you. So I should hire you now because you just helped me out.
Well, I do have one question before you get into too much here. It sounds like we pushed the use of promoted, let's put it that way, the use of Alexa by seniors for a variety of reasons. All right. And one of the things that we talk about with that is that you should have a manager of the system, if you will. And that manager typically might not be the person who actually uses it. So I think what I'm hearing here is that this is the heart of the system that exists in the user's home, and it has a manager that can be anywhere. The manager could be in another state or actually even in another country if you get right down to it.
That is correct. Yes.
So the manager, like if I'm the manager, I have the ability apparently to work with this system, even though I'm in Iowa, and I can set it up for my mother and get all this information.
That is correct.
Yeah. Okay.
So how that works is, well, let's just say working with an individual, a caregiver can gain access, and we give them an admin email and link to log into their individual patient. They can actually see real time when the member has taken the medication out of the pill cup. And we actually generate reports to organizations we work with to show them aggregated reports, how they're kept in compliance with their adherence scorecards. So you could see when you log into this member's account, their exact time of day and dose that they take their meds, weekly reporting, and their scorecard. So if, again, like you just mentioned, thank you, you can remotely go in and see if your loved one took their medication at that 8 o'clock or 8:30. You can go in and see if they missed the dose and call them and say, hey, is everything okay? Oh yeah, I'm good. Did you take your meds today? No, not yet. Well, you got to take your meds, so that's exactly right. This is what is crucial to our system, is that we are able to provide caregivers, care partners, prescribers. We work with all prescribers as well. This information and reporting that we export out of our system, and they can have explicit visibility to every interaction with the device. This also helps increase CMS ratings for providers. And it's a great, option to pair with for home health agencies, because again, say a nurse is out one day and can't go, give the patient their meds or make sure they took their meds, they can go in and see if they took their meds.
Can people, do any of the people use the MedMinder device with their own pharmacy? In other words, I'm the manager locally for my mother, let's say. Can I use my pharmacy as opposed to using your pharmacy? Is that an
Sure.
option?
So it is an option. So Otto, how it works is when a member does use our pharmacy and takes 8 or more prescribed medications, okay, and those prescriptions can include eye drops, inhalers, controlled substances, insulin supplies, insulin, and inhalers, okay? There is no cost to the member other than their current pharmacy copay. They get the free delivery, the free device, the medications, except for their copay. That's all they have to pay. When a member does not use our pharmacy, we are able to do a rental hybrid system. Okay, so even for example, they don't qualify, they don't have 8 meds, they have 3 meds, but desperately need our device's services. There's a hybrid. They can rent out the device, and currently our device is going at a rate of between $110 and $125, okay?
Per what?
So a month, per month, and then you're almost like financing it and you own it at the end of the time. It's, it's about 3 years that it's paid off. We pay for all the cellular data because you don't need a Wi-Fi or landline. We have it hooked up to a 5G SIM card from Verizon. And there's a 12-hour battery life. But to build a device, it's quite a bit of money. So, at the end of the day, we try to make it affordable, right? We work with health insurance, and but at the end of the day, we do have our pharmacy users that don't pay anything but their copay, and then we have people that rent out the device. We work with many assisted livings organizations that have their own pharmacy filling, but they rent out a device for their members to remind them to take their medication and for the adherence visibility and reporting.
We actually have to take a quick break. Jessica, thank you for this information. You're listening to Project Independence in You, Community Talk Radio on 88.1 and WCWP.org. And we will be right back with Jessica Giguere talking about MedMinder Pharmacy.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, along with Otto Lohse and Kristina Liu, our radio show producer. We're talking to Jessica Giguere all about MedMinder Pharmacy, and everyone has so many questions. And I just want to touch on one thing you covered in the very beginning. But you mentioned about all the different customers or clients that could utilize MedMinder Pharmacy, from people in agencies and nursing homes and healthcare. So how does an individual become part of your pharmacy? How does that work? Somebody, and could it be anybody, not just somebody who's a senior?
Yeah, so we service patients of all ages, any age. We have some patients struggling with some mental health, in their, 16. We have patients that are 7 and 8 years old on liquid medications. So yes, there's no required age. The minimum required medications are 8 or more prescribed. We do fill over-the-counter meds, but those are not included in the 8. Our average typical patient has 12 to 15 medications, maintenance medications.
Wow.
So the criteria is it's patients of any ages. They're struggling with some mental health, cognitive disabilities, and just need reminders. I mean, I even need reminders, right? So, I mean, it's a very valuable thing. And we have seen from time and time again, no matter what age, no matter what situation you're in, if you don't take certain medications on time, you could have, a health situation that, can lead you to the hospital. So, you see people with Parkinson's, if they don't take their medication in the morning when they're supposed to, they will, have more trembles or some more unbalanced study behaviors. Mental health patients, if they don't take their medication daily, they can have, some behaviors. So I've seen this with our own individual patients taking their medication.
One quick question too, because for the listeners, I know Otto has a lot of questions too. So just how does somebody get in touch with you? Is there an 800 number? Is it just through the website? How would somebody who's listening today get in touch with MedMinder?
Yeah, so we do have an 888 number. You go on our website, medminder.com. We have an online enrollment form, and you can call me directly at 781-898-4829. My email is jessica.giguere, and that is GIGUERE at medminder.com. And I can assist anyone verbally over the phone. You can send the online enrollment form in, you can email me. And what we need from anyone, these are very specific criteria to help us really get smoothly through the process, is a demographic. So your name, your date of birth, your address, your insurance. Who are your providers? This is really crucial to us because some people will just give us a PCP, but have 5 specialists that prescribe. So we need to know the history and the background. Then we need to know the current pharmacy you're using. New York's pharmacy system is a hard, tough avenue. We tend to do pharmacy transfers because we don't hear, back from the providers as much because they're so busy. So the more information, and then letting us know what ailments the patient has. Should we be reaching the patient directly, or should we be reaching a family member or a care partner? So that's one way we get referrals from individuals. Then we also get them through the organizations, the managed care organizations we work with. So I had mentioned we work with Elder Plan, Health First, so health insurances, City Block. We're in network with most every Medicare, Medicaid, RX company. So that's how it's billed through their Medicare, Medicaid Part D drug RX company, like using any other pharmacy, except for we offer many more high touch individual customer service assistance.
How difficult? I'm sorry, go ahead.
No, you go ahead.
Well, no, these trays that are sent from your pharmacy, let's say, to me, the user, it goes to my house, let's say, right? Are these disposable trays? Like, how hard are they to handle? Like, you have to take one out of the device and put the new one in. What's the process? Is it that whole tray handling, if you will?
Sure. So yeah, that's a great question. So the trays have a cellophane covering over the medication. So essentially anyone could change the tray out because you're not touching the medications, you're just placing the tray into the device. One thing that I'm going to be completely transparent about is MedMinder, when someone's onboarded, went through the process, and they're starting their cycle, we send a home visit tech out to the home to educate the patient, the family member, the care coordinator, whoever's in the home, and is going to assist the members with the tray exchange. Now, the tray exchange is when the medication tray is empty. And again, let's say a patient takes medication once a day. They only need to change the tray out once a month. They take medications twice a day. It's every 2 weeks. If they take medications 3 or 4 times a day, it's once a week. So someone involved with the patient, if it's not the patient themselves, will need to assist with that. And it is very easy. All you have to do is open that top lid that you showed the picture of. At the bottom of each tray is a small triangle. At the bottom of each device is a small triangle. Those 2 triangles match up. It won't go in if you try to put the tray another way. Drop it in, remove the cellophane and close the lid. It's very easy. But again, our population that we work with sometimes, has dexterity issues, memory impairment, most of them actually do, are not able to even do that. So a lot of them will have a neighbor, an aide, a family member. And again, it's those 3 sequence of times that they need to be replaced. But we do offer a video. Someone can call in and say, geez, I forgot how to replace the tray. We'll walk them through it. We have 24/7 services available, and anyone to assist in this matter. But it's not complicated. It's extremely easy. But again, as you can imagine, we're working with populations that really need extensive assistance.
Are they disposable since you're sending new ones? I don't
Yes.
return them, right?
No, they're disposable, and you can add in, we do fill over the counters with a prescription, OTCs, but if you didn't want us to, you can fill in, fish oil, vitamins, wherever you want in your tray configuration, but we're able to do it as well. Now I wanted to mention what happens with a medication change. Our pharmacy will retain the prescription from the doctor. We'll send out a small supply in a bottle of medication during the cycle. Someone in the member's care will have to take the existing medication out of where the new medication needs to go. And we send a detailed instruction form that will indicate all of those steps. But again, they can call us to get confirmation or us to reiterate which row and which pill needs to go in where. So that's the only time someone would need, if they couldn't do it themselves, would need some more clinical assistance.
But it sounds like, well, I use the term manager, that there should be a designated person in any case, frankly.
You are brilliant, Otto.
Yeah,
you are
to work
so
with
smart.
this person who's in the home. And in this case, this is just an extension of what they do. They help with the loading of the pharmacy medications, which they may do anyhow.
Right. I mean, exactly. And medication noncompliance is costly and a high risk to the health of the patient. We have found prior to members switching to MedMinder, they were at about a 50 to 60% adherence rate. After changing and using our system, they went to about an upper 90% adherence rate. And those adherence rates are based on, are you even picking up your medications? Not, let alone taking them. When we deliver that medication, that is the one step to it increasing their medication and adherence and compliance. So the fact that we can deliver medications is a big, huge bonus, and there is no cost when they're taking those 8 or more prescribed medications.
How do you deliver the medication? You said it's 3 days before. How is it delivered?
So we have our own courier services that are, they specialize in healthcare, pharmacy deliveries. They're all background query checked, and we use UPS if it's out of far range, because we are located in Brooklyn, and we service all 5 boroughs. So if it's somewhere out of the mileage range, we will ship it UPS, and we will indicate all of these this communication with the member or the care partner.
So our audience is basically North Hempstead, which is part of Nassau County. Would that typically be UPS or courier?
Both. I would believe both, but I would say it's UPS for now still. I mean, a courier, sorry.
Yeah, we're right on the borderline of Queens as far as that goes.
Yes. And we have technicians that will go out there as well and do the home visit piece. Or, a lot of people are afraid to have people in their home because of COVID. So we have videos, and we can do remote FaceTime with members as well for the setup. But we do go into the homes and set them up that one time after they're onboarded.
What
Now
if
sorry,
someone, excuse me, Otto, what if someone goes to their doctor and they're sick? They have a UTI, urinary tract infection, and the doctor wants them to start an antibiotic or something like that short term, a week, 5 days, 10 days, twice a day. How does that work? Because they would need an immediate, medication immediately. How does that work with the pharmacy?
So typically we can provide same day delivery of medication if we get the prescription by about 1 o'clock. or it would definitely be the next day. If they cannot wait, as you mentioned, and it's urgent, they are not restricted to use a local pharmacy. There's no contract involved here. We are just trying to be an added resource to help patients staying as healthy as can be.
The screen that comes with this device, the picture I have is a family picture on there. Does that screen enable them to, can they make phone calls with this? Can they get other information like weather reports or whatever? You know, is this a device beyond the medication management part of it?
Yeah, so that's a wonderful question, and you are a smart man and ahead of us right now. So we're actually in the process of redesigning our device for those capabilities. Currently, our device does provide the weekly weather forecast, and it can upload any photos from the web or from family photos. So that's an easy thing to upload, any family photos, and then the weather forecast. In addition to that, it can say, Otto, take your medications, or can also, you know, it also provides a phone number if they need assistance. It also comes with, there's a red little help button on the screen that connects to a 24/7 partnering service. So if a patient has a medical issue and cannot reach a phone or doesn't have a phone, they can press that button and the appropriate services will be sent out for that member. So it's an addition, emergency alert button only. But yes, in the future, 2023, we are going to have telehealth capabilities. We're going to have the patient be able to press a button on the device and get in touch with a pharmacy and have those capabilities you are mentioning. So absolutely, it is going there next year.
Is that a touch screen or would it be a mechanical?
It is a touch.
Right.
It's a touch screen. Yep.
Okay.
And I mean, regardless if people use MedMinder, and it sounds like a wonderful, wonderful product, it's so important clearly to use the same pharmacy, even if you're not able to use your pharmacy. I know there's so many seniors. We work with seniors, and we do a lot of medication management programming and education with Northwell, who is our, we go through our subcontracted nursing staff. And it's just crazy, if you're using CVS and you're using Walmart, you're using all these different pharmacies. It's hard, at any age. So, could you talk a little bit about that importance in general about utilizing one pharmacy? And, is there like a technology down the road? I mean, I'm wondering, just to unite all pharmacies in any way so that when prescriptions do go out, since we are all, we're paperless, every doctor now sends their scripts,
right. E-script. So that's a great question. I appreciate you brought that up, and that's what we're trying to do. We're trying to have it as simple and easy as possible. In Brooklyn, we have a phenomenal pharmacist who oversees both the intake process and the fulfillment. So when I talk about intake, it's the team of pharmacists and pharm techs that onboard a patient, get all the information, have it seamless, and then ready for the pharmacy to fill. That one manager in Brooklyn oversees both. And she is not just a pharmacist. I can't even tell you how passionate and empathetic and smart this woman is. Her name is Ashley Marinelli. And I have to give her a shout out because she'll work till any hour of the day to make sure her patients get what they need. And she's a big component of making sure that it comes from our pharmacy. So, you mentioned about the antibiotic, right? And we can say, go to the local and get the prescription if you need it desperately. But let that pharmacy know your main pharmacy is MedMinder, so then nothing gets confused. We also have a document that a patient will sign. We send to their provider to let them know, please don't send to the old pharmacy because we are their new pharmacy. When we do a pharmacy transfer, it also alerts that pharmacy, the previous one, that they'll be using our pharmacy from now on. So we try to communicate to all parties involved, prescribers, all parties involved, that this is going to be their pharmacy. And if they do have another pharmacy, we do try to transition all of their meds over, because what happens is they forget to pick up a script from one pharmacy. They think they're at another pharmacy. It gets complicated and confusing. And we are in the business to make it much easier for the user, for the caregiver, for the hospitals, and all of those people involved. So you bring up a very good point.
What about, I've had a number of experiences. You have medications in tiers 3, 4, and 5. And I'll use Walgreens as an example. Okay, that's $150. And then I go on GoodRx, and GoodRx tells me I can get the same thing for $35. Does that, is that now out of the equation? Because your pharmacy is, going to go by the rules of my drug plan, which says that that medication is $135 or whatever. Will that option of GoodRx still be there, I guess, is the question.
Yeah. So, I mean, it's a valid question. I mean, I'm not going to promise the world and tell you yes every time, but we have our own coupons that we use. When we have a huge high copay, we know we're dealing with certain populations that have, live on a certain budget and low income. And we'll let them know, hey, look, we can use this coupon for you. We do it automatically because we understand that. But if something goes awry where the coupon doesn't work and the insurance is not allowing it, we will tell the patient, hey, look, I'm really sorry. This is what it is. Otto, this does not come up often at all because we have almost like a
Jessica, I'm sorry to interrupt, but we do have to take a very quick break.
Sure.
Question, very important answer. We'll be right back with Project Independence in You on 88.1 FM and WCWP.org.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
Welcome back to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. We've been speaking with Jessica Giguere, who is with the MedMinder Pharmacy, and we're just getting, a lot of really, really excellent information. And, we were just before break talking about, the importance of using one pharmacy, it's really the best way to manage medication for us, especially if, you're an individual living at home and not in a facility of any kind. So, getting back to that point, the importance of it. I know you were in the middle of kind of explaining that process.
Yeah. So it's important to have consistency, and we really want to be members' maintenance medication provider. It comes in prepackaged trays that prohibit people from having to use multiple bottles. This, even like as Otto said, you want to have a manager, quote unquote, but we have so many caregivers that get this for them so they can assist with their loved ones that they're taking care of. Or, a perfect example, I had a 40-year-old son call me about his two 80-year-old parents in their mid-80s. They were coming to his house morning and evening every day so the son could hand out their medications. Now, the mother had Alzheimer's and the father was just so overwhelmed with his meds, her meds. The son, for months, was having the mother and father come to his house 7 days a week to get their medications. Once I set him up, he was like, you have taken such a weight off of me, because now, as Otto mentioned earlier, he knows his patients are being reminded by our devices to take their medications, that the son can go in and make sure they took their medications on the web app, and he can visit with his parents when it's convenient for both of them. He was a full-time professional, had several children and married, and had to take time out of his day, morning and night, to have the parents come over there. So he said we were a godsend. and it really takes a lot of stress and pressure off of everyone. But most importantly, giving the members the best health outcomes, reducing those hospitalizations. It's so stressful to have to go back and forth to the hospital. I had a patient who was in their 60s, mental health. Her doctor called us, said, this woman, is calling people obsessively. She has some behaviors. We need you to go in there. I went in and I said, hi, I'm Jessica. I want to show you your medication tool. This is all yours. No one can tell you what to do. You have complete control over it. And I want to show you it. She goes, oh, it's kind of big. I don't think I really need this. And as I'm looking around this woman's home, it was immaculate, and she kept saying it was messy. I saw pictures of LeBron James all over the house with the limited edition specialty cereal boxes of LeBron James. And I said to the woman, what if I could upload photos on our screens of LeBron James? She said, you can do that? I said, absolutely. So not only did she was able to take her coffee in the morning, see her man on the screen, the device said, LeBron says, take your medications. So in turn, this story was very successful because the member was having less behavior. She was taking her medication on time. Her doctor called me and said, oh my God, this woman hasn't called me as much. I got a call from her a month later. We were BFFs by this time. And she said, Jessica, I'm feeling great. Do I need this still? And I said, I think you should still work with it because, sometimes we feel good because we're actually taking our meds when we're supposed to. And that is crucially and important. So we have been successful with so many individuals, keeping them just feeling their best, out of pain or tapering off medications. We can provide Coumadin. So it's a very special high touch customer service pharmacy as well. The more communication, the better. There's not ever enough communication. So yes, we are a pharmacy, comprehensive pharmacy, but we offer so much more individual assistance.
Did LeBron ever know about this?
I don't know, but that was her boyfriend. Seriously,
Maybe
she was
he'd
obsessed.
do a little home visit if he found out about the story.
That's
Maybe
a different
you
show,
would.
Otto.
A topic that always has to be addressed, no matter what it is you use, buy, whatever, is what does this cost? So maybe you could give an overview with, understanding that, it varies according to circumstances on how it would be determined and typically what might it cost.
Sure.
I just wanted to, I'm sorry, that's a great question, Otto, but I have one question in between there, and then I think we need to understand the cost, and it's just kind of, it's coming to mind, and now, of course, I'm forgetting about it. So you had mentioned insulin, inhalers, and those kinds of things. So sometimes there are medications that you don't need all the time. You just kind of need it when you need it. Maybe your sugar's low, or you're feeling, you're having a reaction, you need to use your inhaler. Is there any kind of monitoring that goes on with this device, or will that be down the road? If someone's sugar is low, or again, like they need an inhaler or something like that.
Yeah, so that's a great question. One thing when we do the onboarding piece, we ask and find out how many, it's called PRNs, as needed medications, do they have currently. Sometimes they say, oh, the pharmacies keep sending us an abundance. And, when we do a home visit, we see they open their cabinet and they have 20 inhalers. So our pharmacy will say, are you okay for inhalers today? So I know I'm talking about two different things, but, we'll ask them, how long do you think you can go without this inhaler? Again, it will save the patient money and, on copays and whatnot. And if they say we have enough for a couple months, in a couple months, because we do a monthly cycle call with every patient to find out if they're running out of something, if they got a new med and we didn't catch it, and how they're doing. So this is like part of our retention program as well. We check in with them monthly, regardless. It's on our cycle calls. And so right now, the only thing we really have in place to ensure that they can take these PRNs is, it will say, take your medication and, make sure you check your blood sugar, take your medication and take 2 puffs of your inhaler. But to answer your other question is, yes, this is coming in the future. More or less, like a doctor can check in, or a family member, did you take your inhaler today? Do you need it? We are going to have blood pressuring monitoring associated with the screen in 2023. But as far as those PRNs go, the only thing we're doing currently today is making sure they have enough. And if they have an abundance of them, do they need it right now? So
And
there's nothing that
just so people
as needed.
listening,
Yeah.
as needed, right? PRN. So like that, not everybody knows all the acronyms and
yeah, as needed medication, correct. So that's inhalers. We also can provide controlled substances, controlled twos, so narcotics with a signature at delivery. Those are required, and an ID on file. So a lot of places can't deliver those types of medications. So that's
Right.
another bonus. So did that answer your question?
Well,
Well,
an inhaler, just to go further with that question, an inhaler doesn't fit in a little box where the
No,
pills would
that
normally
would come
go.
on the side.
Right. So all you can really do at that point, like with the other one, you can only maybe open up the unlock the box for the day they're supposed to take it. You probably have a little less control over the inhaler type medication, but it's better than nothing, because you're still able to monitor and encourage them to take it. You can't make them take it, but you can
right.
at
And
least manage were they told that they should take it?
Correct.
so with the as needed medications, which just kind of you may not need for a month, you may need every day. I assume that's part of the plan because they're getting the medication from you. So it's going to be somehow managed into their MedMinder. These are your as needed medications, and
Yeah, we provide
how
detailed instructions, like all of the meds that are PRNs are as needed they're called bulk items, and we put them on the side. So if someone has prescribed a PRN, but they actually take it every day because they're in pain constantly, and they ask us to put it into the device, we can accommodate that.
right. Okay.
Is this device it's strictly battery operated, which makes it portable, or can it also be plugged in and
So
be like in a permanent location?
yeah, so we do have a 12-hour battery life in the event of a power outage or there is travel, but the device weighs about, I'd say, 7 pounds, 8 pounds. So it is supposed to be stationary and plugged in at all times. If someone has some memory issues, and we've had this before, they keep unplugging it, caregiver can get a notification and call them up and say, plug your machine back in, So it should be plugged in at all times, but they do have a 12-hour battery life, which is good to know, but it has a reserve of 12 hours. People have traveled, like, so for example, you live in New York, but in the winter, you go to Florida, bring your device along. And then when you come home, just let us know the change in address if we need to deliver there. And we're very flexible in that sense, as long as we're notified of these options.
Yeah, when
What if
it's
somebody
closed,
takes-
it's like a little laptop, really.
Yes, correct.
Right.
And would vitamins become part of the plan? Because there's a lot of people that take vitamins too.
So yeah, we can add vitamins in there. They can add their own vitamins in there, but that is not part of the prescribed legend medications that will enable it to be at no cost other than their pharmacy copay if they have one.
Okay, and speaking of copay, Otto, you had a very good question right before about the cost factor. Did you want to go into detail about the question? So Otto was asking about the cost.
Yep.
Yeah, to give a picture of how it's determined, what's the factors that come into it, what might be the average of the people you know of, what might be the average cost per month for typical, like you said, the average is 12 to 15 meds. That's a lot of meds, it seems to me like. But if that's considered average, what would it cost to handle average?
So again, it really varies on insurance, but we bill the RX. So we bill the drug and it's PBM, so pharmacy, like going to CVS or Rite Aid, any pharmacy, it's really the same billing situation. So if you have Medicare and Medicaid, commercial plans, it's whatever, very close to what you're paying for your copay or less or more, but it's in the same realm. if you're taking those 8 or more medications, there's no cost other than their pharmacy copay. If you take less, there's a rental hybrid program we put you on, and we still fill your medications, but we will charge for the device.
Right. So let's say I'm interested for my mother, and I
Yep.
talk to you, and you ask me a bunch of questions and get all the information you need to let me know this is what we would do. At that point, would you then be able to say, okay, this is going to cost you approximately this a month?
Yes. So that's part of our intake process. So the process is, the sales team will collect all the information we need, get everything straightened out. Then you go into the intake process, which is pharmacy intake. They run the test claims on all the medications provided, and they call you and say, hey, you either have, a $10 copay, $100 copay, or no copay. And usually no one's surprised, because whoever has a copay, it's similar to what they're paying now. It's the same situation. Now, if our pharmacy is out of network, it could be higher, but we don't know that until we run the test claim. It's not common that it's higher. We've never had any issues with this, but that's the first step of the process, is to run the test claim to inform the member how much it's going to cost per month for their copays. There's no other cost but their pharmacy copays, just like they're picking up meds anywhere else.
Right. And that the old tier game varies from company to company in some cases.
Yeah, but we're in network with most all Medicare and Medicaid insurance plans in New York.
Right. Okay.
We are this aging in place program. We've been in existence for close to 20 years. I mean, it's unbelievable to think of, but and these kinds of devices and programs and one-stop pharmacy for all your pharmacy needs is definitely something that we do promote and stand behind, because it's so important to make sure that not only do people have one pharmacist, but that you had even mentioned, we touched on briefly, is a lot of times if they're given a prescription, if someone goes in, they're given like 3 prescription changes, and in their mind they might just be, oh, you know what, I'm only taking 50 and I was taking 100, I'll just cut that in half, or I'll they're not getting the actual prescription, and then you're not being informed, and or a different pharmacy. So if you're directly working with the doctor, I think it's just a more closer to a fail safe.
Yeah.
Jessica, is MedMinder a national company, or is it regional, or?
So we're in all state of New York, all state of Massachusetts, because we have physical pharmacies, but we're licensed in 44 other states. So we would just run the insurance and let anyone know which state we're out of network with.
Okay.
How long have you been? All right, well, actually, that'll be a question for another time, Jessica. We'll have to have you back. But I want to thank you so much for sitting in your sunny car with your puppy, doing this great talk on MedMinder Pharmacy. So thank you again for taking the time out for this very valuable information. You're listening to Project Independence in You.